Today I'm going to explain the features of MRI of the cervical spine, particularly in pathological cases where there's some disc prolapse, and how we assess for surgery and what's the parameters we look at in terms of justifying our decision for performing surgery, either to do disc excision posteriorly endoscopically or to do a disc replacement. Now, as you can see here, this is the MRI scan, sagittal plane, and as you can see here, there's a vertebra, and in between there's a cartilage space or the disc space. Now, this disc space should not protrude, as you can see here in the spinal canal. It should came flush. And here it is protruding, it is pushing slightly the spinal cord, and if we reflect that on that section here, you see that how the disc space is pushing the spinal cord. Now, one section below, you can see that is even more pushing on the spinal cord, but I prefer the 2 millimeter section above the disc space to see the foramen where the nerve is exiting the spinal cord, because this is the widest point, and that would assess the width of the canal in that position. The cutoff point for us is something like 2.5 millimeter. And if I measure this canal here to here, it's about 1.6. So for me, this patient is not going to improve without surgery, and likely to require a decompression and disc replacement, mostly because I prefer in all times to carry out anterior surgery rather than posterior, considering that the pathology is coming from the front. It is anterior, it's not posterior. And considering that if you only remove the disc without putting a disc replacement or a cage, you don't resolve the axial neck pain issue, you only resolve the arm pain. Now, for this patient, he came complaining of neck pain radiating toward his left arm over the period of 2 years. We did this MRI scan, we can see the bulge in that disc and that disc, and we assess the width of the canal together with the clinical findings of pain, radicular pain and weakness, and we decided that this patient requires surgical intervention, and the preferred operation for me in this respect is usually a disc replacement. As you can see here, this is the 2 vertebrae, and we put this artificial disc replacement with a piece of art actually, which changed the practice in spinal surgery significantly over the last 10 years. You can see I'm moving the vertebra one on each other, and the disc space is allowing all this movement to happen. So we preserve movement and we preserve the anatomy all over the time. So this is a patient post-operatively. You can see we took the 2 discs out and put this artificial disc replacement, as you can see here. This is the AP and lateral view. So as you understood from this is the preferred treatment in my practice for cervical disc prolapse causing axial neck pain and radiculopathy or arm pain is artificial disc replacement. This is the way I assess the need for the surgery radiologically, as I did explain on MRI scan. Of course, clinical assessment, including the effect on activities of daily living, the type of pain, severity of pain, play a higher role, but obviously the patient already assessed in that respect. Thank you very much.